Thank you, everybody. The meeting is now live.
Good morning and welcome to the Local Outbreak Engagement Board. I'm Councillor Dale Birch and just need to acquaint everybody with the meeting etiquette, and that if you could mute yourselves, etc., etc. And you can leave your cameras on, and there will be a roll call of those present, and if you could use meeting chat to indicate if you wish to speak, etc. Please refrain from using the meeting chat for anything other than the meeting etiquette. Please check you've got whatever background you're comfortable with. If there is the need for a vote, there'll be a roll call. If we run into any technical difficulties, then if I drop, then Councillor Barnard will continue the meeting, etc. So the first item on the agenda is for apologies for absence.
Chairman, I've received apologies from Fiona Slevin-Brown.
Thank you. And we're going to, if you switch on your microphones to confirm who is present, Christine, when she calls your name. Thank you.
Thank you, members. Councillor Dr. Barnard.
Present.
Councillor Birch.
Present.
Councillor Brunel Walker. Andrew Hunter.
Present.
Sorry, Andrew.
Present.
Thank you. Abby Thomas.
Present.
Kelly Williams.
Present.
Cynthia Falarin.
Present.
Elena Rozelle.
Present.
Chief Inspector Andrew Cranage.
Present.
Philip Cook.
Present.
Are there any other persons present whom I've not called? Please turn on your microphone and advise when I call your name. Timothy Whedon.
Present.
Paul Betterson. Maureen Mandawahi.
Present.
Tessa Linfield. Sarah Bellars. And Charlotte Pavitt.
Present.
Are there any other participants in attendance? Please advise that you're present via the meetings chat, and you'll then be asked to turn your microphone on and confirm. Chairman, I don't have any other indications in the meetings chat.
Thank you, everybody. So we move straight on to agenda item 2, which is the declarations of interest. Do we have any declarations of interest? I don't see anything in the chat, etc. And that's fine. Moving on to agenda item 3, any urgent items, please?
No, Chairman, I'm not aware of any.
Okay. And any public participation?
Chairman, I'm not aware of any questions from the public that have been submitted to the committee Dropbox.
Okay. Thank you very much for that. The next item then is agenda item 5, and is a look at the national and local COVID-19 status. And I think that's Cynthia, over to you.
Thank you, Chair. I'll just share my screen. I'm hoping everyone can see.
Yeah, that's there, Cynthia.
I'm trying to navigate to the. Let me stop sharing and try and start again. I'm trying to get my screen back to the beginning, but I'm having difficulty with that, I'm afraid. So I'll talk you through what should be on screen, because I can't. Let's try again. See if I can come out of it. I can't share my screen, I'm afraid.
Okay, just talk us through
try
it,
again.
Cynthia.
Okay, so the data for this week is looking at firstly starting with the Berkshire rates and specifically Bracknell Forest rates. You'll see for the week beginning week 39, dated 14th of September to the 20th of September, that Bracknell Forest rate per 100,000 has dropped considerably, some 40%, to 12.2 from a previous 20.6. That's quite significant. It's almost halved, and shows that the level of cases in Bracknell have significantly reduced. There's also another chart that's showing you that we are sitting in relation to the southeast and England. We've actually sitting just above the level of the southeast in terms of our rolling average for cases, and so we're heading in the right direction. And it also means that we're sitting under way under the England average. There are also maps that I was hoping that you'd be able to view that provide an overview of the number of cases across Bracknell and where they have happened across the borough. And there's a spread right across Bracknell, to be fair. Unfortunately, I can't show you the actual maps, but I think the key thing is that our rate has come down considerably. We now have in Bracknell 484 cases between the date of the 7th of September and the 21st of September. And that is, and then there are 14 cases specifically between the 14th of September and the 21st of September. So that's the weekly number of cases to date. Thank you, Chair.
Thank you. Does anybody have any questions on that update? No. No.
Chairman, can I just ask just kind of the figure of 484, Cynthia? that's not in the last week or two. That's the cumulative figure.
That's the cumulative
from the
figure.
beginning of the outbreak.
Yes.
And the number in the last week was about 15, something like that.
14. Yes.
14. Okay. Thank you.
Good. Any other points that anybody wish to? Yes, Andrew.
Cynthia, just a question. How does that compare with our neighbours?
In terms of
the rate per
rates?
100,000?
So if we just think about the East Berkshire, and we're looking at Slough, Windsor and Maidenhead. So Windsor and Maidenhead, who were at 41.1 per 100,000 last week, they've now reduced their rate by 58%, and they're at 17.2%. And then Slough, who were at 20.8 per 100,000 last week, they are now down to 20.1%, which is a 4% reduction for them. So we're sitting just above Slough, but below Windsor and Maidenhead. And then if you want to go slightly wider than that to the east, to the west, which is West Berkshire, Reading and Wokingham, again, we are sitting in the middle of the rates.
Thank you.
Okay.
Can I just ask a very quick question? So
Sure.
when we see, Chair, when we see those big sort of swings in percentages, is it worth emphasising this is because actually it's a low number on a low population? So, you know, we'll see that variability that will have a greater level of noise, because in bigger areas, they'll have that sort of damping effect. So, you know, it's just an indication of just how localised some of these things are. Is that, Cynthia, the best way of looking at this, really?
Yes, exactly that. That is the best way to look at it, Gareth.
Yep. The smaller the numbers, the bigger the effect. Yep. Okay. I've got Tim, you've done yours. Yep. Thank you. I'm going to move on to agenda item 6, communications and engagement update. And Elena, I believe that's in your capable hands.
Yeah, thank you, Chair. Good morning. I'm just going to try and attempt to share my screen. Just bear with me 2 seconds. Can everybody see that?
Yep.
Yes.
Yep. We're in.
Brilliant. Thank you. So I haven't gone through the objectives of our comms plan because we've covered those off in the past couple of meetings. But what I'm going to take you through this morning is just what we have done to reach harder to reach audiences, broadcast communications, our reactive communications, and some challenges that we've faced since we last met. So preventative and proactive communications that we've done to reach hard to reach audiences have largely focused on the Bracknell News column and some Bracknell News advertising for older residents who we know through Ofcom research and other local government research still trust the media as their main source of information. We're using that weekly to get out a different topic on things that are relevant to that age group per week. We've got a 6-week full-page advert going in with the Bracknell News. We're halfway through that, and we've already used testing. So messages around it's really important to get tested, but only if you have one of the 3 symptoms. Face coverings, and this week we're focusing on the NHS app, which is launched today. For BAME audiences, we have used an influencer. She's actually a medical doctor. She's also a fashion blogger. And we had really high engagement with that one. It was really good ROI because we had an increase in young followers and young followers from BAME backgrounds on our Instagram, which means that now we're getting out more messages of our own. We don't have to pay for them. They're already there and they're engaging with us, so that was a really good piece of work and something that we do need to follow up as well. For younger people, because we knew that we were having an issue with cases rising in younger people, we focused on them quite a bit over the past couple of weeks to help try and drive that down, specifically around wearing your mask and social distancing. So we commissioned some photography around young people and young people from a variety of backgrounds, not just white British backgrounds, but BAME backgrounds as well, so that people looking at those felt that they could identify with the people in the images. So far, the Wear Your Mask, Protect Me campaign has reached over 10,000 people on social media. We're planning to supplement that with more posts organically and paid for advertising, but we will target that to youth audiences so that we know they're getting our messages. We've also commissioned some bus backs as well, which will drive through the borough with that image on it so that it's almost like a moving billboard, and that will start in the next week or so. Again, for young people, we've adopted a slightly harder stance. We've used a Why Aren't You Social Distancing campaign. It's very similar to the campaign that we did with parks during the summer, and that seems to have gone down quite well. We've had some really good feedback from Bracknell and Wokingham College, who are very happy to share that with us. It's also gone out via our sixth forms. It's also gone out via the Youth Council as well, who've been very supportive, and we'll continue to follow that up as well. We're also working with our care leavers. Our internal team have agreed to produce a pack with us so that people leaving our care have got the right information. They've got leaflets, they've got masks, and they've got all the information they need. And we're also looking to work more closely with our Youth Council and producing a video over the next couple of weeks. And finally, with younger people, we've looked at, we're looking at different poster sites. This work has already started with some much more different sort of messages to normal that actually speak to them in a language that they use. So it's used things like got a fresh trim, so people have been to the barbers, make sure you go home and wash your hands, make sure you keep your distance. So it's using things that they actually, that resonates with them, language that they use, not that we use. We're looking to extend that campaign and the one about why aren't you social distance into the train station, because I know there has been concerns that that is an area where people aren't keeping their distance, specifically younger people. So we'll add that in as part of the campaign as we move forward. Preventative work that we've done in terms of broadcast communication, so not specifically targeting a sector of the population. We've continued with daily social media messaging around different topics. We've added in the rule of 6 as well and the NHS app over the past couple of days. And we're using a mix of local and national assets to try and keep it fresh. We're having to commission more photography and videography to pick up on a point that Councillor Birch mentioned a couple of weeks ago, just to make sure that it doesn't become like wallpaper and actually it is engaging. And we have seen the numbers certainly on social media still being relatively high. So we're confident at the moment that that tactic is working, but we will keep that under review. We're doing a weekly town and country, which is mirroring those messages and those images. And we've done a letter to parents via our schools about testing, about symptoms, and ensuring that parents know that their children are social distancing and keeping to the rule of 6. Just because, as I've mentioned previously, we need to target young people, but we also need to make sure that their parents are coming at them from the other end. We do have a leaflet, so it's sort of more than a leaflet, it's more like a magazine to go out to all households, which I updated the board on a couple of weeks ago. We have held back on that deliberately because we knew that there were going to be some changes to the national guidance, so we didn't want it going out before we had chance to actually put the updated guidance in there. So we're working on that now with an anticipated delivery date in early October, which will bridge the gap between town and country editions. That will also reach people who don't necessarily engage with lots of written text, because we want to keep that quite visual and quite streamlined. Thank you to everybody who has fed back on that one. I have noted your comments and we will look at the content and circulate it as well. One thing that I have seen recently, looking at different networks, for communications, is that Central Bedfordshire has set up a model where they've asked people to come forward as community champions, and community champions to actually deliver comms messages. So it works almost like a corporate cascade. You give them the message and they distribute it. They might be a chairman of a local football association. They might be an admin of a Facebook page. So we're going to work with our engagement team and our community response team to actually try and step that up and get that moving forward. It's quite a quick win in terms of getting our messages out to a wider audience, to people who don't necessarily engage with our channels, but we don't then have to pay for it either. So it's quite a nice way of getting that information out quite quickly. And we've also got a radio advert in production. We're just refining the key messages around hands, space and face, and that will go out on Heart FM, as well as a load of digital channels as well. In terms of reactive, we have caught up previously on the Caspers outbreak, so I won't go through that in much detail, but just so you're aware, we did do 3 press releases and statements, and we did digital and social. I counted up yesterday the reach of that, and it was around 45,000 people organically across all channels. So it did have a really high reach in the end. People were engaging with us. So that's good to know that we are actually hitting our audiences with the right information at the right time. BBC Radio Berkshire actually followed up with an interview, which was really helpful because Councillor Brunel Walker was able to reiterate some of the key points. And we also did a video follow-up on social media to talk about young people and the rule of 6, and that actually this outbreak was linked to young people. So young people, please do start social distancing if you're not already. And we've also been extremely proactive with our schools. They've been absolutely great to work with, and they've really helped to provide that community reassurance with our help and liaison as well. And finally, I just wanted to update the board on some challenges that are happening at the moment. I'm sure you're all aware that we've had some issues around testing. So we have been quite vigorous in our and rigorous in our attempt to get information out that if you have symptoms, you still must try to get a test. If you don't have symptoms, then please don't apply for a test. We've had lots of frustration locally, so we have empathised with people that we do understand their frustrations, and this is how you potentially do get a test, but reiterating those key points. We also used the Bracknell News advertising and the leaders column for that, and it was in the letter to schools. Our press release was actually shared with colleagues at Frimley as a template for best practice. So that was really very supportive of the Frimley team. The NHS app has launched today, as I'm sure you're aware, on national media. I just wanted to highlight to the board that we are working on a campaign around like that. But unfortunately, a lot of the national assets didn't drop in until very last minute. We were getting things yesterday and the day before to actually roll out for yesterday and today. So we're not as on the front foot as we would normally be with that campaign, but we have started it and we will continue to support it. We've got some video work planned for later on today. We've got press releases going out. Our website copy is live. It's just, we would have preferred to have been on the front foot a little bit more with that one. And our colleagues across the LEP and the PPP and the police have been really helpful in helping us to get that information out to businesses that they must download this QR code and display it. And there are some training courses for them today and tomorrow, which we're continuing to support and get messages out on. That in a really quick run through is what we've been doing in the last month, but happy to take questions.
Okay, that was quite comprehensive. Thank you. Questions then, please, from members. Gareth.
Yeah, thank you. It was just an observation that I'm definitely not the world's most IT or app savvy person, but actually the app does download very easily. I think the one thing that we should be conscious of is, and it's been flagged today, that if you have an older smartphone with an older version of iOS that's about 5 or so years old, that it might not work on your phone, but that it's not the be all end all because it's the anonymized app. The other thing I think we need to be quite clear about is it's for people over the age of 16. This is not an app for all members of the family. It seems pretty intuitive. And I think the other key thing which I've observed is providing businesses are conforming to the requirement for track and trace. It should make actually accessing restaurants and other venues like that relatively straightforward through the QR code. I know that there's been a lot of negativity around, you know, whether this will or will not work, but the fact is it seems to download. Today it seems to be live, up and running. And I think it's absolutely right through our comms that we promote the use of it. The other observation I have is that we've discussed putting in place a lot more messaging for young people, and I'm really pleased that the Youth Council and others on board to actually share messaging young person to young person. We know that there are pinch points across the borough where young people will have done and will in the future congregate. It would seem to me that are we exploring how we might be able to further promote the wearing of face coverings in spaces like that? Because actually, if you take Bracknell Railway Station, you know, particularly before and after school, you have maybe people from 5 or 6 schools either using the station or using it as a meeting point. So, you know, if we're looking at managing the risk going forward, what work are we doing just to try and make sure in those places and spaces that if we can't maintain social distancing, we at least encourage wearing of face masks and things like that?
Yeah, so one of the things that we are looking at is actually commissioning some face masks that we actually purchase and hand out. So yeah, that is one of the things that's on our radar as well. We just haven't got around. Yeah.
I'm really pleased that we're investigating that, because if nothing else, it might just bring home what's going on. I think the other thing just worth noting here is that our schools, particularly our secondary schools, are doing a fantastic job in trying to, you know, getting children back into school. But I've seen from 2 different schools this morning letters where students are still not turning up in school with masks, or sorry, face coverings, to use the proper word, I correct myself, face coverings, and the school is actually providing them. Now that is clearly an unsustainable position for schools to do going forward. So can our messaging also include reminding parents that in addition to ensuring that they have what they need for the school day ahead of them, that they add to that list face coverings, maybe by some sort of checklist type approach, because that would seem to now be one of the sources of concern and irritation in schools, because of course they do have to police it for the bubbling, you know, the bubbles and all those sorts of things there. But that's just something which seems to be coming to the fore now. But an amazing start to the term. I mean, head teacher, senior leadership team seem to me to be absolutely in control of the situation. And I believe that parents are very comfortable and confident with the procedures that school have in place to keep all members of the school community safe. I think the face covering wearing one is something we could actually try and promote and help would be helpful.
Yep, absolutely. We'll pick that up with our schools team, no problem.
Thanks. Thank you very much. Elena, perhaps not for you to answer, perhaps for Chief Exec, but we're getting messaging across to all these people. What happens if they're not complying with the messaging? What happens?
So it's a very interesting question, and one that we need to that we probably do need to discuss the approach. You'll see that the government is moving towards much more enforcement. Police are being given powers. The level of fines are going up. There's now a requirement on people to self-isolate if they're told to do so. Realistically, I think we have to accept that we cannot, and Andy is on the call, but the police cannot monitor everybody who has to self-isolate. But what we have, the experience that we've had over the last 3 to 4 weeks dealing with certain outbreaks, is that very occasionally you come across people who really do not accept their responsibilities and the need to do that. And so the approach that we've taken throughout has been one of trying to persuade people and trying hard to persuade people to follow their obligations, to meet their obligations and to self-isolate. But if that proves to be impossible after 3 or 4 engagements with the people, then we will act and we will use either the powers that we've had in the past, or we will be looking to use the new powers. So if I can give you the one example, that the ice cream parlour in the town, there's a Regulation 3 notice, so it's not allowed to open until the 25th of September at the earliest, and there are very clear conditions that need to be complied with before it can open. I have to say that was done in cooperation with the business as well. But there have been 1 or 2 people that haven't been isolating, that may have been linked to that, and they have had a visit from our environmental health people, and I think accompanied by the police as well. Certainly that was the intention. But it will be as a last resort, but it will be used as a very much as one of the tools in the armoury.
Thank you. Okay. Any other questions to Elena on the comms side of things? And looks like we're thank you.
Just pick up on the chat, Chairman, that I said they're opening on the 25th. They're opening on the 24th. Apologies.
Yep. So today, there we are.
Today.
Good. Good correction there. Well done. Right. That was agenda item 6, and the final item is to review any ongoing the action log for the board. Are there any action? Is it Christine that will be looking at that?
Chairman, I'm more than happy to run through quickly just to ask board members to provide an update. So the first item is the local outbreak plan, which was last updated by Kelly Williams on the 18th of September. Kelly, do you have any further updates for that status?
Yeah, thanks, Kirstine. So a couple of points. We talked previously about including information within the plan that will outline responsibilities for residents and for businesses. Having consulted with colleagues across the Berkshire authorities, we are looking to take a streamlined approach to this. And as such, whilst we've made minor reference to those points within our updated outbreak control plan, we've actually used other avenues to ensure that those messages are communicated clearly to our businesses and our residents. The outbreak engagement plan is currently being updated, and the final published version will be published by the end of this month. we will continue to update it as and when we make new developments, and that will be any summary information will be updated on our council website.
Thank you.
The items that follow, hedged out in grey, are completed items. The next item was on the 30th of July, the terms of reference. Under the terms of reference, Elena was to consider how to publicise the board and communicate how members of the public can engage. Elena, do you have an update for that at all?
Yeah, so one of the main ways that we're going to do that is through the magazine that I mentioned earlier. Unfortunately, that has been pushed back. So we can do some interim comms around that to get it out to the public. But the main way to do it will be through that publication, which will go out around the beginning of October.
Thank you. The next item, 30th of July, item 7. Cynthia, to describe closely associated with the tables in future reports that blank entries represent suppressed data where numbers are small. That's ongoing, and I presume Cynthia is perfectly happy to continue to do that.
Yep.
Okay. The next item would be Elena Rozelle and Tessa Linfield to develop a number of statements that can be utilised quickly without the need for lengthy approvals in the event of an outbreak.
Yep, I've drafted those. They are with Tessa and colleagues for approval and sign off.
Lovely.
Fantastic. Sorry, Chair.
No, carry on. Carry on.
Okay, thank you. The next item is Elena Rozelle to develop a communications plan to reach non-English speaking residents. Elena.
Thanks, Kirsteen. I've been working with our engagement team on that. I don't know if Abby has any update on that one from the engagement side.
Yes, so Elena and Harjit have been in a conversation about that, and we've now got a number of actions have been identified to reach specific communities across the borough, looking at where there have been tests taken up and where they're sort of where the infection rate is and positive cases are. So we're looking at how we reach out to, for example, the Nepalese community and others.
Thank you. The next item is all board members to notify the board of any false or fake news. I haven't been notified of any notifications, so this is just to ask the board if there's anything they'd like to report.
I have nothing. I'm seeing shaking of heads all around. So that's good. Was that the final action?
No, there's 3 more, Chair.
Okay, carry on.
I just want to check with the board whether or not Dr. Jonas Thompson McCormick provided the board with data that showed the number of tests for COVID-19 carried out within Bracknell Forest that was a private action. Did board members receive that information?
Yeah, that was ages ago. Yeah.
Thank you. Fantastic. I can close that down. The next one is all board members to discuss the possibility of producing a printed communications piece to bridge the gap between the production dates of Town and Country magazine between July and November. Elena, is that action closed?
Yes, that's been agreed, so it can be closed. Thank you.
Fantastic. And the final item is arising from the last meeting. Kelly Williams and Abby Thomas were to revisit and redraft the terms of reference to make them more agile and responsive in the event of an outbreak.
That has been done. Those have been circulated with the Chair.
I think we're nearly there on that one, aren't we? Yeah, I think that was answered earlier. Thanks for that.
Fantastic. That concludes the action log, Chair.
Okay. Well then, thank you very much for that. And thank you all for your participation this morning. And to note that the next public meeting of the Local Outbreak Board will be on the 22nd of October. And I always say this, but it's nice if we don't need to meet again until then, because that means things are under control and looking good. So I look forward to seeing you all again on the 22nd of October. Thank you very much. The meeting is closed.
Thank you, Chair.